Hello friends, and this is Chris, and welcome to a very short book review video. I've not done one of these before, but I decided to do a review on a book on traditional Chinese medicine, as a lot of my students have been asking about traditional Chinese medicine. A lot of my students are actually starting to choose to see a Chinese doctor of traditional Chinese medicine for whatever reason. So some of them have been saying, can you recommend a good book? So what I'm going to do is just do a very quick video on this particular book, which is called The Web That Has No Weaver by Professor Ted Kaptchuk, Professor of Medicinal Science at Harvard University in America. As you can see, it's not a light read. And although he's a professor of medicinal science, most of this book is actually research evidence, and this is important from an academic point of view, but this is not an academic book. This is not specifically written for medical students or health professionals. It is a book that anybody can read. It's a very readable book. Professor Kaptchuk explains a lot of the ideas around traditional Chinese medicine through anecdotes and talking about people he's met and patients he's worked with over the years. As you can see, yes, it is a thick book, but also again, if you are a student or you are a health professional, the reason why it's such a bulky text is because it is full of research evidence. This is very, very important because a lot of the criticism from the West, especially health professionals and academics, is that traditional Chinese medicine tends to be a wee bit too abstract. It tends to be a wee bit too kind of out there for us in the West. So what Professor Kaptchuk does is he provides Western medical research evidence to show that this is absolutely not the case, that traditional Chinese medicine is based in logic, reason, and also as well evidential proof that it does have a therapeutic effect. Just as important is that he's showing research evidence as well that proves that traditional Chinese medicine works not on a placebo effect basis, that it works because it does have a treatment effect. It has a therapeutic effect. So what's a placebo effect? A placebo is when a patient is given something that they think is a medicine, but it's not. It's a dummy or an inert tablet, for example, like a sugar-coated tablet that has no medicinal content. But because they believe it is a medicine, then the brain is fooled into thinking, the brain is fooled into releasing pain-killing hormones or stress relief hormones, and that appears to have a therapeutic effect. So again, a lot of the research in the book is to prove that traditional Chinese medicine is not a placebo. So again, this is very important when we come to acupuncture, because I know there may be health professionals out there who look at acupuncture and say, yeah, okay, well, it works, but it works because the patient thinks they're getting better, or they think that they're relieving pain. But no, acupuncture works because acupuncture works. So again, the book goes out of its way to evidence that. So this is why it's such a thick book, there's loads of research evidence in the book. As you would expect, Professor Kaptchuk knows his stuff, and he goes into a lot of detail regarding the principles or the main pillars around traditional Chinese medicine. So explaining concepts that we are not familiar with in the West, like qi, and concepts and ideas like yin yang, but also as well other elements and ideas in traditional Chinese medicine that for us in the West are just a wee bit too abstract. So he does talk about or write about Shen, and anybody who does Qigong will know, and maybe a wee bit about what Shen is, but for those people who don't, in traditional Chinese medicine, you have the energy of the body, the qi, you have the essence of the body, the jing. But the Chinese also say you also have a spiritual element to this as well, called Shen, S-H-E-N. And again, it's very much a Chinese concept. but it's an integral part of traditional Chinese medicine. And he does explain about Shen and how important it is in traditional Chinese medicine. The only thing I would say as a criticism of the book really relates to when it was first published. And the book was first published in 1983, and it's been republished again numerous times. I think this edition was published in 2000. But the criticism I have of the book is that it really does need to be updated. It really does need to be brought into the 21st century. So I mentioned Qigong, and again, Qigong is a part of traditional Chinese medicine. The book makes no mention of it at all, and possibly because when the book was written, although there would have been people doing, for example, Tai Chi Chuan or Qigong in America, it wouldn't have certainly been as popular as it is now. The other key omission in the book is there's a missing chapter on the Chinese health system, on Chinese NHS. Possibly because back in the early 80s, China was just beginning to open up to the West. And I'm guessing that Western doctors would not have had the same access to Chinese hospitals as they do now. But this is important because to truly understand how Western medicine ideas, contemporary medicine, and also traditional Chinese medicine work together in a Chinese hospital, you kind of need a chapter on that. And there are lots of videos on YouTube actually showing how the two treatment paths, disciplines work together in a Chinese hospital. The book really needs that, but because of when it was written, there is that omission. But I would definitely, if you are interested in Chinese medicine, especially if you're a Tai Chi teacher or a Qigong teacher and you want to know a wee bit more, especially around diagnosis, how a Chinese physician diagnoses the condition of the patient, is fascinating. I found that truly fascinating. How a Chinese physician would take the pulse of a patient using 3 fingers, and each finger would be used to indicate the condition of the patient, not just how their blood's flowing and how the heart's beating, but any other type of issue that the patient might be experiencing. The other one as well is fascinating is how a Chinese physician would look at the patient's tongue and look at the tongue and see how the condition of the circulation of the blood in the body is occurring, whether there's a problem or whether it's healthy, or maybe it's too healthy, there's too much heat or coolness in the blood, yin, yang again, by looking at the patient's tongue. So again, that in itself is really interesting. And if you're a teacher of Tai Chi Chuan or Qigong, and you're interested in knowing a wee bit more about the health approach, I would definitely recommend this book. The only thing I would add to all of this is that the title of the book is also very important. For me personally, what I learned from the book is it wasn't until I read the book that I realized how little I understood conceptually about traditional Chinese medicine. And the reason for that is what I thought I understood was based on a Western point of view. To truly understand traditional Chinese medicine, you have to look at it through the traditional Chinese window. And there are 2 windows. There's the Western medical paradigm window, and then there's the Chinese window. And the best way to explain this, just to finish with, is in Tai Chi Chuan, there's a movement, there's a posture called the Fair Lady Weaves Shuttles, sometimes known as the Jade Lady Weaves Shuttles. And we take that as an analogy for how we look at traditional Chinese medicine. A Western health professional would maybe look at the lady weaving or the jade lady and say, who is this mysterious woman? Why is she weaving? However, a Chinese physician of traditional Chinese medicine would ignore the weaver, would ignore the lady, this mysterious lady, doesn't ask why is she weaving. He or she would look at the pattern of what they are weaving, not individual threads, but look at the whole pattern, what it is they are weaving. What is the pattern of disharmony? What is the pattern of harmony? Again, looking at the whole pattern, not looking at one individual thing. So in the Western approaches, Western paradigm of medicine, cause and effect, pathology, which is very important. But the traditional Chinese approach would be that's important, but it's only one part of the overall condition of the patient. What we need to look at is the overall condition of the patient. It's not about the weaver, it's about the pattern they are weaving. Hence the name of the book. Professor Kaptchuk actually explains it a lot better than I just did. And you can get this on Amazon. It's available on Amazon. I bought this for £19.99. So you can order it from Amazon. And you probably, if you've got Kindle, I'm sure you can get a Kindle version as well. So just to summarize, yes, I would definitely recommend this book. It's a wee bit, it does need to be updated. It's a wee bit behind the times, but it still gives you a very good overview of the ideas, concepts behind traditional Chinese medicine. And there's a lot of Western research in the book that backs up the statement that traditional Chinese medicine does work as a treatment approach. Okay, I hope you found that useful.